Here, myself introducing, not only myself but the clinic. Every time I spoke to the patient prior to the procedure, they just gave me this blank look, and it wasn't very surprising to see why, because in both ears they have fully occluding hairs. Now these are hairs that have collected over the years by the patient trimming the hairs on their tragal cartilage. So the tragal cartilage is the piece of cartilage, the flappy bit just before the entrance of your ear canal. It's almost triangular in shape, and men typically get loads of hairs there, and the patient trims these hairs, and has been for many years, and these hairs have just flown into the ear and gathered. So there is some hairs here where at the moment on the side of the ear canal, they are attached to the ear canal, but the hairs that I'm plucking out the ear, they are completely loose, and I was just astonished by how much hair I was removing. And if you continue to watch at the end of the video, you will see on a tissue just how much hairs there were. It was just incredible how much hairs that were compressed. And to confound that, the patient had been using cotton buds, they've been getting water in the ear. So this is the patient's left ear. In the right ear, it was actually, there was a bit of discharge, a bit of infection. Now, sorry if you're not seeing all the hairs being plucked out as I'm coming out of the ear. When I'm doing the procedure, I'm fully focused on the procedure. I'm not thinking ahead about editing and recording, and obviously in hindsight, it would have been probably a bit better if I took these out, just shone the camera on the hairs as I removed it out of the ears. But as I said, I was fully engrossed in removing this from the ear. I allocate half an hour per patient, although typically it only takes me a few minutes per ear, if that. But however, 1 in 20, maybe 30 cases, they are very complex like this one. It can take the full half an hour. In fact, in total, obviously I've edited the bits when I'm out the ear, but in total it's about 45 minutes I was with the patient, and we have other patients waiting as well. So whenever I'm doing a procedure, I'm focused on that patient at that moment. But you probably see I'm clearing the entrance of this ear, and every time I'm going in and coming out, I'm extracting a flock of hairs. It's just incredible. As I said, the patient had been using some drops and also been getting water in the ear. What makes it a bit more tricky is that the patient's ear canal is quite bendy and twisty, it's quite narrow. There is a plug of wax deeper in the ear that has been impacted with a cotton bud. There's loads of skin adhesions, and you will see that once I clear all these hairs out. So every time I'm coming out, there's like a flock of hair. So we're getting a bit deeper now in the ear canal. The patient did travel quite a long way to see me today. They have had this problem for a while. They've attempted to have it removed in the past unsuccessfully, and they were waiting for a referral to the hospital to see an ENT doctor. And that's when they came across my YouTube channel and decided to travel down and visit me to see if I could help. When you've got this amount of hairs, it's very difficult to use suction because the hairs prevent a suction grip being obtained. Again, just going back in. I asked the patient how long they've been suffering for, and they said for a couple of years now. And it just progressively got worse, but in the last few weeks, they have really noticed that they weren't hearing well at all. Friends and family have been complaining, and with Christmas coming up, he wanted to get it sorted prior to Christmas. So it's kind of your worst cocktail, really. You've got a narrow ear to begin with, a bendy ear on top of that, very hairy ears, matted earwax, a bit wet and slimy in there. So you couldn't really ask for a more complex and tricky case. But as you know, if you've been watching my videos, I do enjoy doing all the complex ones. But yeah, by far, this is the most hairs I've ever removed from one ear. every time I'm extracting, I'm going in with the forceps and coming out. It's like a plug of wax that I'm removing. It was just uncanny. Again, another big flock of hairs being extracted. So we are clearing the entrance now. So we have given tips to the patient whenever they trim their hairs in future to place some cotton wool at the entrance with a bit of Vaseline, not to push the cotton bud in, sorry, not the cotton bud, the cotton wool, but just to seal the entrance and then trim the tragal hairs. And that will prevent the hairs from flying into the ear. Of course, I've explained to the patient to not use cotton buds because that's just further impacted this into the ear. And I've advised the patient to avoid water as well because obviously water can lead to an infection, swimmer's ear for example. So this is a bit as opposed to hairs, bit of wax now. There's a few hairs around the edge. So just gone back in with the suction probe just to see if I can suction the wax now because there is a few less hairs, but it's very sticky. So I think I'm going to put some drops in. I'm going to use an ear hook as well to see if I can hook it out. If you continue watching, I think personally the right ear, although it was a bit quicker procedure, the right ear was a bit more challenging because the ear canal was a bit more narrower and there's loads of hairs that are stuck on the eardrum directly and on the periphery of the medial ear canal wall, and I managed to extract that using forceps as well. There's a bit of otter ear, a bit of pus on the right side as well, so do continue watching. And as I said, at the end of the video you're going to see a clip of all the hairs close up on the tissue, just so you get some perspective. There are also some still images of the hairs on the tissue, so you can visualize yourself how much I removed. So this plug of wax, it is impacted medially. I used a bit of suction, but just gone back in with the forceps just to get a few more hairs out. You can see how I'm just slowly use the bottom jaw to manoeuvre the hairs away from the back part of the ear canal so we don't make contact with it before slowly extracting. Again, just using the bottom jaw to lift the hairs away from the bottom of the ear canal so we don't make contact before I grip and pull out. So what I'm attempting to do here is just lift this plug of wax. There's a bit of wax and dead skin. You can see the white skin at the bottom, the fresher layer of skin that's strongly adhered. Just trying to manoeuvre that off the canal wall. I am going to go back in with forceps and bring this forward if you... I don't think immediately. I think I'm going to use a hook as well, but I will eventually I've managed to use some forceps without touching the canal wall just to bring this forwards. I'm just trying to loosen it all the way around the base of the ear canal, so not only the back part where we are now, but the inferiority. So in terms of complexity and difficulty level, this is probably as difficult as it gets just because not only the ear narrow, the view's obviously tricky with all the hairs, and it is always difficult to remove hairs from the ear. And the patient was completely relaxed throughout the procedure, no discomfort whatsoever. So I've just gone back in with the microsuction tips here, what we call the zone, the suction probe. You can see a lot more of the ear canal now. So the lateral part of the ear canal, the outer half, it's all been cleared, and it's just this medial plug towards the eardrum. So the last centimetre and a half that we need to remove. Fortunately, this plug of wax and skin, it's like a chewing gum. It's really embedded itself, adhered itself to the canal wall. It's almost like chewing gum consistency. So I'm just trying to lift it off the roof of the ear canal as well. So I've just put a bit of oil in there. And whilst the oil is in the ear, I'm suctioning. So it's always a bit more tricky because you can get a bit of blurriness. I just find the more and more... I used to instill the drops in the ear and then drain the ear. And occasionally I still do that, but I'm finding more and more that if I can suction whilst the drops is in the ear, I get a better result. So the patient's head is tilted across, so the left ear is facing upwards somewhat. I'm just going to be careful. You can see it's a bit blurry when the oil's in, so we're just going to come out, regain focus. I'm just going to be careful. You probably see there's an indentation just where I was before, so this plug of wax is not actually coming out. It's the suction probe is almost not pushing it in, but it's imprinting the tip of it on the surface of the plug of wax. So just be careful that we're not pushing this further in and lodging it and making it uncomfortable. And what I'm trying to do is just loosen this skin off the canal wall. You can see it on the back part of the ear canal. That skin is slowly getting loosened. Again, we're just going to be careful with the oil. I think now I'm going to potentially use forceps. Let's see. That's it. I'm just going to go to the bottom now. We're on the bony part. I'm going to be so gentle that we don't make contact with the ear canal wall, because that'll be very uncomfortable for the patient. And just lifting this up and out of the inferior part of the ear canal where it's lodged. Again, I'm just going to go back in with the suction probe just to lift it up again. I'll just put a tad more oil in there just to lubricate it. And as I'm getting a suction grip, I'm slowly trying to withdraw the suction probe away and out of the ear just to see if I can manoeuvre this out. When you've got a suction grip, sometimes if you pull the suction away too quick, you just lose the suction power, so you're not really moving the wax or skin out or extracting it. It's kinesthetic feel. Once you're in the ear, you feel it, and you feel that if I bring the suction tube, if I move it too quickly, I'm just going to lose the grip. So I'm doing it slowly, I'm feeling it there, but it is lodged at this point. I can just feel the resistance. The ear canal's a bit narrower here, and the plug is a lot wider, and it's just stopping there. I can't bring it out any further forwards with suction. So I think we're going to use a hook. I'm going to try my very best to get to the top part of the ear canal, but because the ear is narrow and bendy and twisty and on the bony part, it's really tricky. I did manage to actually get the hook in and behind, but as I brought the hook forwards, it just dissected this plug. It did bring it slightly forwards, but it's not bringing it out of the ear, so it's just like a hot knife through butter, really. It's just dissected it, which sometimes is useful because you can go back in with the suction probe and you are able to vacuum a bit when you're just dissecting it. Slowly just bring this forward a tad. And I'm now going to go back in with forceps. Let's see. There's a bit of hair there that I can grip onto. Problem when it's mushy like this as well with forceps, if you're not careful, you're just going to cut into this plug of skin and wax. You're just going to, like scissors on paper, as opposed to getting a grip and bringing it out. So you're going to be gentle. You don't want to over pinch the forceps, because then you'll just be cutting through. So you've got to apply the right pressure. It's a bit more tricky as well because the colour of this skin and wax is quite dark. It's oxidised, so it can sometimes camouflage itself alongside the forceps. The reason why we, in ENT, typically we use, so this is some stainless steel forceps, but they've been tinted black, and that's to prevent glare. So when you're looking into the ear, you have to have some sort of light source, whether it's an endoscope or microscope, and that can introduce glare. It can reflect, a bit like the suction probe, but you do get a bit of glare sometimes, and so that's why some of the instruments are tinted in black. So I'm just trying to dislodge this. Forceps wasn't bringing it any forward, so I've just gone back in with a sucker. I think I'm going to use the ear hook again to see if I can bring this a bit further forwards. If this ear canal was a bit bigger and straighter and wider, it would have made the procedure a bit easier, I feel, because I've had more manoeuvrability in there. I must admit my hands were tiring somewhat as the procedure was. I think now I've been in the ear for about 17 minutes. It's constant, going in and out with forceps, applying pressure with hooks, stretching the ear, so it can put a bit of strain on your hands. I think this is the big plug. So a bit of keratin around the edge. So I'm just going to suction this out. Came out really easily, this last bit. There is some part on the roof of the ear canal as well, and I'm going to go back and get that. So the eardrum's intact, and there is a bit of dullness, a bit of dry skin, a bit of otitis externa with the water in. And that's the patient's eardrum. So lovely clear ear now. Onto the right ear. Now the right ear, it's a lot more gooey, bit of discharge, it's a lot more narrower. Ear canal's more inflamed. So I've just gone in with the suction to see if that helps, but like the left ear, it wasn't going to come out. So you can see it's a bit more blonde in here. It's a bit more yellowy in colour. It's not dark. The hairs look more like hay and straw. So I'm just going to use forceps just to burrow myself through. It was quite smelly this through as well, so there was a bit of an infection. You could not only see it, but you could smell it. So I'm just using the ends to get stretched here. You can see all that, how wet and gooey it is in there. So occasionally I do use suction just to suction some of this wet discharge, just to dry it up a bit so I can then go back in with the forceps. The patient themselves were quite astonished at the end of the video or the procedure, and when they saw the contents on the tissue. They asked whether it was normal, and I had to say that typically no. It was quite a haul. Just see how narrow this ear is. It makes it a bit more tricky to get the forceps. These are micro forceps. They're fine jaw ones, so they're very narrow, which helps me when I'm inserting it. And we've got to be careful now because the tip of the forceps have got a sharp point, and we've got to be careful that the sharp point doesn't poke against the eardrum. So you can just about see the eardrum now in the distance. You see the pink part straight ahead. It's really good. I'm going to go back in with suction in a minute just to mop up a bit. Just to dry it out so I've got a bit of better view. So just remaining hairs are actually on the eardrum, and they're stuck to the eardrum with all the discharge. So the patient's been advised to use some acetic acid spray, so like a vinegar, just to help with their otitis externa. So the ear canal is actually clear in some respects. The hearing's fine now because the sign can get through, but I just want to get the remaining hairs out if possible because there is quite a lot and they are stuck together. So I'm just lifting it off the roof of the back part of the ear canal here, and I'm going to go in forceps now. We're going to be so careful because we're right near the eardrum now. So you need to have a really steady hand. Just getting into the hairs and then slowly coming away. Again, I just want to mop up a bit, it's quite wet in there. So the eardrum is visible. You can see the pink part there, that is the eardrum straight ahead. But I'm just going to see if I can get a bit more of these hairs out. So I'm just back at the roof of the ear canal, just bringing these adhered hairs just downwards, away from the canal, before I go back with forceps and pinch them away. There was some stuck in the anterior recess as well, which came out when I with the forceps. So you can see more and more of the eardrum. I'm just using a fine end now. We're on the eardrum itself. I'm just going to suction as much of this off the eardrum as possible. So again, I'm just going onto the eardrum. So they have got, as I said, otitis externa. They will need to use some spray. Got to keep their ear dry as well. So I'm really pleased with that. You can see the eardrum is bulging a bit. Don't want to put any more pressure on that. And then, so we're happy with that. That's the procedure done. And these are the close-ups of the hair strands, the flocks of hairs. And you will see some still images in a moment as well. It's just remarkable how much hairs came out. And all that's hairs. So there's only a little bit of wax.